Now the next thing is transverse pericardial sinus. You have seen some cardiac looping. Let us look at that again. If you remember, we have discussed that there is one upper arterial end, which is truncus arteriosus region, coming anterior, anterior and anterior. So what is the lower venous end doing? Lower venous end, which is right horn, left horn of sinus venosus, going posterior, posterior and posterior. This is what we have discussed earlier. And also we have discussed that in this cardiac looping, there's one sinus which is passing in such a way that the arteries will remain anterior and the veins will remain posterior. Let us talk more about this sinus. And looking from the lateral view of the heart tube. As you're looking at the lateral view of the heart tube, what is it doing? It is doing the cardiac looping. And what is cardiac looping? See, the lower venous end goes posterior, posterior. Yes, posterior, posterior. Then what is the upper arterial end doing? Upper arterial end is coming anterior and anterior. So it's coming anterior, anterior. Yes, what is it doing there? You remember what is truncus arteriosus giving? The truncus arteriosus is giving, it is giving the pulmonary trunk and ascending aorta. Pulmonary trunk and ascending aorta. Pulmonary trunk is more anterior, ascending aorta is posterior, but both of them would have come from truncus arteriosus. And what is between the arteries anterior and the veins posterior? What is between the arteries anterior and the vein posterior is the transverse pericardial sinus. One question has come upon that. You put your finger in the transverse pericardial sinus and pull the two arteries anterior. Why? Because it is a procedure done in the OT. So in the operation theater, you are operating on the patient now. What operation you are doing? Something to relate with the heart-lung machine. Where is your finger going? Finger is going into the transverse pericardial sinus. And why are you putting your finger in the transverse pericardial sinus? Put your finger in the transverse pericardial sinus in the operation theater. Some heart-lung machine operation going on. And what do I do now? You pull the two arteries anterior. Pull the two arteries anterior. Why should I pull them anterior? Which artery I am pulling? You will see that the arteries which you are pulling anterior are derivative of the truncus arteriosus. Who is that? That is the pulmonary trunk and the ascending aorta. Pull them anterior. What will happen when I pull them anterior, the derivative of truncus arteriosus? Then you pull them anterior and put some cannula inside them and put a ligature around that. So putting some cannula inside the vessels and putting ligature around that. Yes. So which vessel did we pull anterior? The derivative of truncus arteriosus. Yeah, which one? See, there is the pulmonary trunk. Is it pulmonary trunk or pulmonary artery? No, not pulmonary artery. Actually, pulmonary trunk. Come from the truncus arteriosus, not the pulmonary artery. Pulmonary artery, you remember it came from? Pulmonary artery and the ductus arteriosus came from a separate origin. What is the origin? Pulmonary artery and ductus arteriosus. So I think it came from the 6th pharyngeal arch artery. Correct. 6th pharyngeal arch artery will form pulmonary artery and ductus arteriosus. This is different. So what is this? This is actually pulmonary trunk. Different from pulmonary artery. Who else was anterior? The ascending aorta. So pulling the ascending aorta anterior. Now, yes. Okay, what is behind your finger? Behind my finger will be the veins. This is transverse pericardial sinus. Behind that is veins. Can you name one vein behind the transverse pericardial sinus? You can see here, superior vena cava. So superior vena cava is behind your finger. Yes, it is behind my finger. It is behind the transverse pericardial sinus. It's already one MCQ. Everything goes on the class is already one potential MCQ which will come in the latest coming exams. That's how we approach the subject.